I'm sure you've heard of runners doing carbohydrate loading, where the night before a big race, they eat a big bowl of pasta. Did you know that you can do something similar before surgery and it will actually improve your experience and decrease your pain? It's called carbohydrate loading. The reason that runners do that is that when you eat all of that pasta all at once, your body can't metabolize all of that energy. It's just too much. So it takes it, breaks it down, and reassembles it as glycogen in your liver and your muscle. This is a readily available food store, which is awesome when you're about to run a marathon. It's also really beneficial if you're about to have a surgery. The reason is that the night before surgery, you're going to have nothing to eat or drink after midnight. And then if your surgery is later in the day, you just kind of wait around, once again, not eating or drinking anything. And then your body goes into surgery, which is this catabolic experience, which relies on the breakdown of protein and the mobilization of energy in order to provide all of the energy that's needed to allow you to heal. So one way you can facilitate this is by drinking a glucose drink the night before surgery. Studies have used anywhere from 50 to 100 grams of glucose, and it's usually done prior to midnight the night before surgery. Some have done it just a couple hours before surgery. And what these studies have shown is that it improves patient satisfaction, it decreases the blood sugar dysregulation that can occur when you are fasting and not eating the normal meals that you're used to, which is somewhat counterintuitive. Eating a sugar drink decreases your blood sugar dysregulation, but it interestingly does. And most interestingly is that studies have found that it can decrease how much pain you feel after surgery. That's super interesting. Now, some surgery centers use this as the routine protocol. They'll tell patients to have a carbohydrate drink the night before surgery. But if your surgeon doesn't bring it up with you, or if your anesthesia team doesn't address it with you, it is something that you should discuss with your surgeon. You can still adhere to those nothing to eat or drink after midnight guidelines and just have 50 to 100 grams of a glucose drink right before midnight, before your fasting restrictions begin. If you've had surgery and your surgeon or an anesthesiologist discussed this with you, let me know below.